Record this computer. Welcome to our second February sales call, where Dr. Shania Grody is going to talk to us about how to use patient stories to sell to them with confidence. I'm so excited to learn about this, so I will let you just take it away.
Yay! I'm so excited too. So, first off, I want to give a shout out to Meg Brady House. Go follow her on Instagram at Meg Brady House if you're ready to level up your life. And then also Macy McNeely, shout out to her as well. Go follow at the Sales Girls Official for more selling techniques and tactics, because some of the content that has been created, not the patient-centered focus, but just the overall concepts, have been pulled from both of those lovely ladies who are absolutely killing it in the business space. So good use of your time if you're looking for some new people to follow. That will definitely blow your mind. All right, so goals today, we're going to be telling people what they need with confidence based on their story. So I am going to use Kelly to kind of ask a few questions today about how can you tell someone what they need. So how can we tell our patients and our clients what specifically they need? There is a number one rule. Now, Kelly, I'm going to have you have a crack at it, and then we'll kind of go over it together. But what do you feel, and it can be multiple things, what do you feel are some important points that you need to know before you can tell someone, and that someone being a patient or client, what they specifically need?
In terms of type of treatment, frequency of treatment, what are you thinking
Yeah,
with that?
just in general, if you're trying to like sell them on your service, whether it be initial eval, dry needling, any type of, bulb force plate assessment, anything, what do you feel like you need before you can tell them what they need,
I
essentially?
need to know their goals. Like, I need to know what
Love it.
they're trying to get to, because it can be
Mm-hmm.
very different for someone who like all they want to do is be able to walk their dog. And then there's someone else I have right now, they call it a 14er, and they want to do a 14,000 foot elevation climb. Like, and they're both patients with meniscal tears. So it just looks very different depending on what their goals are.
Yes. So that right there, she hit it on the head, their story. And the number one rule is we want to listen more and talk less. So
I
in
thought you were
order
going to
for,
say, ask clarifying questions.
yes, that is one, but this is like definitely pull from the sales girl. So listen more, talking less. So what Kelly had said just specifically there with the goals, like if we didn't listen to that story about that 14er, like how would we even know they want to conquer the elevation? They might have just had a specific, injury with the meniscal tear and been like coming to you, and then we're looking at the quote unquote face sheet, not truly the patient, right? We're looking at their injury, not the person as a whole. So that's really important to obviously listen more and talk less so we can learn their story. So
Hmm.
people love to talk about themselves. I don't know if anyone's ever thought about it, but I think the biggest thing is like you all know that like family or friend who just goes on forever, and we love them, right? We love them. But that's how we kind of want to look at this scenario in terms of when we're asking our patients. Like we want to be that like quote unquote like shoulder to cry on, not really, but like, that person like that's there to listen and like truly listen. Like we're engaged, we're there, we're ready to learn. And the biggest thing is like you want to play into that and channel them. When is the best time to do this? The best time to do this is in an initial consult call or when you're doing like a free injury screen. So you can get some of those details right then. So then you know the best path forward. Like Kelly had said, their goals, right? So if she does a quick consult call with this individual with meniscal tear, she can delve into those details and just listen by talking less within 15 minutes and know right then and there she needs to get them on for an evaluation this week. So that's the biggest thing is we always want to listen more and talk less. And I think if you think about like your free consult call, I'm going to turn a little bit, or an injury screen as like story time, I think that just sheds light on the fact that like they literally are telling their story. Okay. So like the goal is to learn patient stories, right? But we can't do that unless we're talking less. So we just got to remember that although we want to tell them all the things, we just got to listen first, and then we'll present what we need next. So next line of business, clarifying questions. Kelly teed me up.
Oh,
Okay.
there we go.
Asking several questions before you present what they need. So Kelly, what do you feel like is a good number of questions that you feel like you'd want to ask a patient and or prospective client before kind of presenting quote unquote the offer or what type of service they would need next?
I mean, I'm gonna have to at least ask three, I feel like. Like,
Okay.
what are your goals? What's keeping you from them?
Hmm.
Probably what have you done before?
Love it. Love it. So I think one of the ones that we always touch on too is like, have you had physical therapy before? Like we always want to learn about their prior experience. So that's awesome. But I'm gonna go up a level and say five. Okay.
Okay.
So this is obviously a little overkill. And some people who are watching this are probably like, well, that's a lot of questions, right? But the more questions that we can ask, the more we can learn about their story. Because we get down, right? Beyond the surface and a little bit deeper. But the more questions you ask, the more clarification that you're going to get. So this is a good rule of thumb. Now, you may ask 10 questions, you may ask four, but again, aiming for more is better. Okay. And now we're going to throw this into a specific patient scenario. So I'm going to tell you a little story that actually did truly happen. So I had a specific male patient with shoulder pain on the books who had booked a cupping session and kind of had just been good with manual therapy. And then came to me and was like, I think I need to go see a specialist. And I'm like, oh, we got to ask some clarifying questions because why are we going to see a specialist when we were just coming in for a little bit of muscular discomfort? So some clarifying questions that we could ask in this scenario. And this could be any type of patient that comes in for a specific service that maybe you want to like switch it up, right? This is cash pay physical therapy. This isn't like, okay, this is what the face sheet says. So we're gonna delve in and go that step deeper. We're gonna say, okay, so what makes you say you need to go to a specialist? So what makes you say that is like a common thing we like to say in terms of a clarifying question. And so then this individual was like, well, I'm training for a triathlon and I feel like, when I swim and I do my long 90-minute swims, it's not really getting better. I'm like, okay, well, when do you notice, like, did you notice that the kind of exercise performance things, because we also worked on some of that too, did you notice that that helped your shoulder when you changed the form inside the gym to translate into swimming? And he was like, oh, yeah, yeah, that previous session really helped me. I've noticed that my lifts, my left shoulder is actually a lot weaker now that I'm actually doing the movements right. But I feel like I'm doing them correctly, but it's just like there's something else going on. So I'm gonna continue the conversation. And then I was like, okay, well, are you still wanting to continue to train for the triathlon and lift, right? Like you're still wanting that, right? And then he's like, yes, we're getting the micro yeses. And I'm like, awesome. Okay. So would you like to get the bottom of your injury today so we can lessen your pain and you can attend your stroke mechanics session tonight? Because he literally had a swim coach lesson that evening. And he was like, really? I'm like, yeah, you could be in less pain by tonight. And he was all in. So then I went a step further, which I probably could have just finished then. And I was like, would you like home exercises too? So you can begin them today and you don't have to, wait a week or 2 or 3 to see a specialist. And he was like, sold. So you see where we get to 4, like Kelly had said, like 3 or 4, like you're good probably, but doing a little bit more is just going to elicit more buy-in. So I always want to say like more questions are always better because you get to the bottom of it and you kind of know what they want. And even like the micro yeses, like you might already know the answer to some of these, but just asking them in a new light or just kind of bringing their attention to them and them being the patient is going to add more clarity. So we tabled it at the 5 questions. Okay. So then my next thing was like, okay, what are we going to present now? So this is what happens. We have asked the questions. Now we got to present our offer. So Kelly, what do you think I presented next?
An initial eval.
Exactly. Spot on. So I was like, okay, perfect. We can do an initial eval today instead of cupping to get to the bottom of it. And this individual was slotted for like a 30-minute session. So we did the eval and we got it in an hour and it was good. And then the biggest thing is there was no hesitation in my presentation because I knew that's what that patient needed. It wasn't like, oh, do you want to do cupping? Because, we booked it for a half hour. You'll feel good. I was like, no, you need the eval so you can continue to do the triathlon. And there was no hesitation. So the biggest thing with these questions too is we want to ensure there is no hesitation in our delivery because we are the expert and we are the clinician and we're not asking them what they specifically need. We are asking them their goals, but we are prescribing what specific treatment they need. We are the experts in the field. We gain the information so we can tell them what they need with confidence versus hesitation. So no hesitation in delivery. And then we always want to sell or present the offer after those 5 questions have been asked. We're not like throwing it in the middle. And then one other thing I want to add in is, do you think we should send them a service menu or a PDF file? Kelly.
I don't. I don't because they're gonna this is hard because sometimes people will be like, well, do you take insurance? How much do you charge?
Right.
Clearly, there's a very like definitive answer to that.
Mm-hmm.
But that answer, it can all like, I want to be able to speak specifically to why they're asking that question. When I send them the prices or I send them a service menu or I have it
Mm-hmm.
listed,
Mm-hmm.
people glance at it and there's an automatic either A, they don't care because they have a lot of money, or
Mm-hmm.
B, like a no. There's no,
Mm-hmm.
oh, like you're not selling in that instance, you're not selling your value. You're truly just selling a number that's tacked onto a visit, you know?
100%. So that's something I want to shed light on too, because I feel like we're so like, hey, can you send me your prices? So do not send the prices via email or PDF. And
Okay, I
so,
do have a question. If
yeah,
I hope I don't throw you off.
no, you're
So
good.
with the no hesitation in your delivery,
Mm-hmm.
how do you, because what we'll get, I'll be a little bit of devil's advocate, what we'll get
Yeah,
from people often from our providers is like,
yeah.
oh, I've never charged this much. I'm going up on my prices. I just like, oh, it's almost like you're selling poison, kind of like, oh, but
Mm-hmm.
what we a little expensive, but what I
Mm-hmm.
actually think is best. I'm guilty of this too, is like, I mean, I know it's more than the cupping session, but I
Mm-hmm.
really think what you need is initial eval, even though it's
Mm-hmm.
like twice as much.
Mm-hmm.
Like, is there something that you tell yourself? Is there a technique? Is there like
Mm-hmm.
how would you coach someone, Shania, that's dealing
Yeah.
with those thoughts?
That's genius. So yeah, my evaluation is like $110 more. So it's more than double of what cupping would
Hmm.
be. So yes, it's definitely like the sell. So where the sell comes is the story. So not even like price point, like I'm selling the value and the payoff like we've discussed in other sales calls. But like in my last two questions specifically that I had asked, I'm literally under promising and over delivering. I'm saying, awesome. Would you like to get to the bottom of that today so you can go to your stroke lesson tonight and actually continue to train for your triathlon? There's like little alarm bells going off in the patient's head at that point in time that the monetary value is not a concern at that point. Now, if this was someone who maybe wasn't training for a specific event, but you thought, hey, I think you could benefit from an eval, and they're like, well, kind of want to try that cupping first, I would say, okay, well, the beauty of this is we can actually do the cupping treatment in the evaluation as well. And this is going to give us more information because although the cupping may, assist with that shoulder muscular discomfort today, really the exercises and, delving into what's really going on in your shoulder is going to give you more long-term success. So you don't have to keep coming in for as many visits. Does that sound good to you? So I would kind of paint it a few different ways. So if it's someone who has that tangible goal, like the 14er or the, patient who I had who was doing a triathlon, like those are easier sells because there's a tangible goal, right? This triathlon is a spring, so there's a
Hmm.
timeline. We need to get it done, right? But someone who's in lay population, who's maybe an older individual who doesn't really care because they're retired or they don't have that tangible timeline, that's going to be more of like we have to sell the value of what that session can provide. But I always like to say like they came for that service. So I always will present that as something we will do in the evaluation as well, not just as a standalone treatment and the benefits that we can provide from physical therapy with an evaluation versus just the cupping. Does that make sense?
Hmm. Yeah, and what I'm hearing from you when I kind of like
Yeah.
read between the lines there, it's
Mm-hmm.
very much like it's like when your kids don't want to eat the vegetables. It's like, I know that this
Mm-hmm.
pie, this cake, this cookie looks really good, and like we can get to that. But
Mm-hmm.
what's really best for you is to get to the bottom of this, and that's what you want, right? So
Mm-hmm.
it's, and you don't know what that best is without the story, like you're saying.
100%. Yeah. So I think like there are going to be some individuals who you will do the cupping and then it'll just be kind of have to wait and see, right? They come back to you in 2 weeks and they're like, you know what? I really took into consideration what you said on that last cupping session. I do want to go forward with the eval. So sometimes like it's not a one size fits all. It's going to be kind of a season to taste type of deal. And it's going to be based on their story. If they are retired, they may just want to try the cupping. And
Hmm.
then they come back and you're like, hey, I know we talked last time about that eval. I do really feel like you would benefit. And then you sell them on that second visit and get more into their story. Like, hey, we did the cupping. What do you feel like you're still limited? And then you can learn more. So just asking more clarifying questions too will help with the sale.
Okay.
No, that was a
Yeah.
really good question, Kelly. Thank you. Okay. So what I wanted to explain too with the not sending the prices via email or PDF is, like Kelly said, it's overwhelming. There's an automatic like yes or no going off in the head,
Hmm.
but also it's like, here you go. What would you like? No, 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 no. We need to tell them with confidence what they need. So if we send them a service menu, it's kind of like when you go to a massage place, you're like, I don't know if I need the LED treatment and this and that. It's like, okay,
Yeah.
I
So
don't
then you
even,
pick something in the middle because you're like, I
yeah,
don't know. I'm gonna get the one in the
exactly.
middle.
So that's the same thing. If we send them the prices via email or PDF, they're going to be like, I don't know what I need. Do I need cupping? Do I need dry needling? Do I need a nival? So what we need to do is listen to the story and then tell them what they need. Okay. And then after
Hmm.
that, which we're going to get into next. So now we've gone through this case scenario. So what's next? So we've done the selling, we've gotten them into the evaluation, but I want to really hammer this home is you are never done selling. You may have sold that initial eval, but it is not done. It is never done. Okay. Buy into the follow up, buy into the home program, buy into the discharge. You need to continue to follow up with your patients no matter the situation. Okay. So, biggest thing is you need to confidently deliver the number of sessions they will need. So, they come in for the evaluation. Kelly's a pro at this. And she's like, I think that you, or no, not even I think. We don't need to think. Based on what I've
In
seen
my
today,
experience or
yes,
what I've seen in your eval.
yep. What I've
Hmm.
seen in, this type of injury, tennis elbow, you're going to need 6 visits. And each visit, we're going to, make solid progress. And the beauty of this is I actually have a package that is 10% off discount where I can, hammer home in 6 visits where you're going to be. And the beauty of that is if we get to 5 and you're feeling really good, that 6 visits is just going to put you up here. So maybe we get here, it's just going to add a little bit more. And you can even tell them that, if we get to visit 5, and we feel like we need to push that one out more than the once a week cadence, we can do that so that they feel reassured, because sometimes patients will be like, well, what if I don't need 6, right? So you can sell them on like there is still going to be value in that last session no matter what progress has been made in between. So I
And
really
you know
want to
what's interesting is I'm sorry I interrupted you.
no, it's good.
Out of all these packages that we've sold over, we've spent 1 year really honing in on
Mm-hmm.
packages. And that was the first thing I thought was, well, what if I don't need it? Do you know
Mm-hmm.
I've never had a single person say that?
Hey, that's so good. See,
Never.
I have.
So really,
Mm-hmm.
yeah.
They'll be like, and a couple of our providers have come to me and be like, what do I say? I'm like, this is what you say. You can still
I was
provide the
fully
value.
prepped for it because
Yeah.
I thought that was going to
Mm-hmm.
be the first thing that they would say. I've
Yeah,
never had.
that's so
And I
good.
think it goes back to like confident in your delivering, like, oh,
Mm-hmm.
this is what you need. This is what your body needs to
Yep,
repair. And you being sold on it because you can't sell it if you're not sold on it,
100%. And I think too, if we think about like insurance-based care, right? Someone has a total knee. They're like, you're gonna come in for 8 weeks, 2 times a week, 30 minutes. No one's questioning that. Like that's what
Right?
it is. That is what it is. So why don't we
Hmm.
always treat it like that? Because we're in a different space. So then it feels uncomfortable sometimes. So we really have to be confident, because what Kelly just said just hammers home that if the confidence is there, from a 10-year clinician who's been treating for over 20 years, no one's going to bucket or question it. So let's just keep that up.
Hmm.
Also, I want to tell everyone that like the offering is literally the same. We're literally offering 4, 6, or 8 packs. It's just the story that's painting it different. And that's so mind blowing, because it's literally you're selling the same exact thing, but it is tailored to the individual. So the confidence level should be up here, because the package isn't changing. The price isn't changing. The number of sessions aren't changing. What's changing is their story. So we need to be
Yeah.
confident listeners and really present in a way that's going to feel like, okay, I got this. I'm going to get you better in this many visits, and this is how it's going to go. And then you explain the course of care in terms of a POC after that, plan of care. Okay, so I want to go into each of these. So with the follow-up specifically, so when they come in for a follow-up, what are some things that you do, Kelly, to build confidence in, first of all, it's going to be the patient, but also you as the clinician, the treatment you provided. So if you want to give like a specific example of how you'd elicit some buy-in in a follow-up, and then I'll give a couple that I have as well.
I try to be very specific and I'll be like, okay, well, we're going to try to do, um, thinking of somebody, a track athlete
Yeah.
that I'm working
Mm-hmm.
with. I want you to go at 50% with this run, this 2 mile
Mm-hmm.
run you have going up, and then I want
Mm-hmm.
you to taper up. So I'm
Mm-hmm.
going to very specifically, when she comes in tomorrow, I'll say, hey, how hard were you able to run and for how long? Like it's going to be very specific questions based on
Mm-hmm.
what their goals are.
Yes. So that's exactly right. You're showing and you're highlighting their progress and you're confident in the treatment that you just provided. So that's the
Hmm.
big thing. So you want to show and highlight their progress with confidence. So the biggest thing with that, like Kelly's telling them, how far were you able to run, right? So for my swimmer, I was like, okay, same deal as what Kelly said. We're just going to keep this using this example. I was like, he's like, I have a 90-minute swim on Sunday. And I was like, okay, well, this is our eval. So we're going to swim for 10 minutes at a moderate pace. And we're going to see how that 10 minutes goes. And then he was like, no, I didn't have any shoulder pain. So then I went a little bit longer and I actually ended up going for a half hour. And then I left and I was like, still below a 3. I'm like, good. So you keep tracking that progress, but that's going to build their confidence in your prescription of exercise and treatment. But really, it's their work that is, also eliciting the results. So you have to have a little bit of autonomy too, to feel like, okay, yes, Dr. Chandler told me to do XYZ. I did it. Now I can. So it's like they're also feeling heard and seen to a point that like they're bought in for those follow-ups, because now they're like, oh, can I run farther? Can I swim farther? And they're going to continue to be bought in. Okay.
Hmm.
HEP, Kelly, you do great with this with PhysiTrack because you can literally see if they did their program.
Yeah.
But in terms of like keeping up with the consistency of whatever cadence you're prescribing, what do you feel like is a good way to elicit buy-in for an HEP in general?
You know what I've started saying lately is that because I'm a manual therapist, so I do a lot of manual therapy, and I'll say,
Mm-hmm.
this manual therapy with my hands, this is what's going to get you feeling better, but the exercise is what keeps you there. So
That's
unless you
really
want to
good.
keep coming back and be completely
Mm-hmm.
dependent on me, and that's not what
Love
you
that.
want, right? And they're
Mm-hmm.
like, no, then you're going to need to do the home exercise program. With some of the younger population, I will say, I'm going to see you in 1 week, so I need to have 4 check marks before you can come back because they like coming. It's fun. And so I'll
Mm-hmm.
say, okay, you've got to do this program 4 times before your parents can bring you back in. Is that fair? And they're like,
Love
okay,
that.
yes, I can do that. Yeah.
I love that. And I think like the biggest thing is just like asking, like, are you keeping up on it? Like I literally
Hmm.
every single beginning of every single session that I do for a patient follow-up, I'm like, how many times did you do program? Like cut and dry. Like let's
Or
get to
show me what you did.
it.
Because if
Yeah,
they can
let's
do
see.
it, then I know they've done it.
Mm-hmm.
Yeah.
And
I
I'll be
need
like,
like,
did you do it? And then I'm like, okay, so did you do the in and the out with like a certain move, whether it's AB or adduction or like internal external rotation? Oh, I forgot the out, but I did the in. So it's like just ask
hmm.
them. And then I also will quiz. That's another thing I'll do. I'll be like, okay, so today we're doing, 3 sets of whatever, 12, but I had you doing some isometric holds. How many rounds were you doing on those? Well, the sheet said 5. Yeah, that's right. But today it's 3. So they're like confused. They're like, I think it was 3. And I'm like, did they actually do it? So I think too, like just like simply like asking specific questions is key, because that's how you're gonna, and then show versus tell, like Kelly said, like
Hmm.
let's see it. I always ask that. So we want to make sure, and that also like they're like, oh, like she's gonna ask me next time, or he's gonna ask me
Hmm.
next time.
Hmm.
Like, whoa, light bulbs are going off. They're gonna start doing it more. Yeah, so that's very, very good. And I also think too, what I will also shed light on that I didn't, I'm going to give this 3 little stars. Very important. Show versus tell is I will literally call out strength numbers on testing and look at range. Like, okay, you did the in, but you didn't do the out. Well, that's why our external rotation is so weak still. Like, we need to work on that. Otherwise, we're only
Hmm.
going to get here. So, literally showing them objectively, like, what's happening. And then also asking them, like, oh, did you notice in, this lift or this, pattern with your swim or with your run, if it's a specific, knee injury or something, what did you notice when you did your exercise? Well, it actually felt better. Okay, awesome. Let's keep doing them so we can keep feeling better. So just like adding a little more autonomy in there is going to elicit more buy-in. Okay, our last one. So post discharge. This is literally when what Kelly had said, like, okay, your manual therapy gets you here, your exercises are going to keep you up here and get you even farther. Together, we're going to make great strides. But now what? So we're discharged. Okay, I don't want you relying on me. But what is going to be a good way to ensure they're keeping up on what they need? Kelly, do you have any bells and whistles going off? Because you have something you offer that is really good.
Do I? No, I'm like, tell me more.
This is Kelly's bread and butter that she just updated everybody. Stay tuned. Maintenance membership. So
Yes, yes, yes.
she knows. She's like, oh, okay.
I
So
know.
maintenance membership. So what this is not a reliance tool. I just want to say that it is not a reliance tool. It is a tool to ensure that continual gains can be made. So this is not a one size fits all either. So
Like
Kelly,
call oil change.
yeah, exactly.
Like
I
you
always
still
use
need
that
a, you
analogy.
don't have to go to the mechanic because we like
Yes,
fixed it. But you still have to get
yes.
your oil change. You still have to
Hmm.
come in. And I will have people come in where I'll just say, hey, you're doing great. You're able to hit these goals. Your pain is at this. How about we come in for in 1 month and do a tune
Hmm.
up? And that is where
Hmm.
occasionally I will do a half-hour visit.
Yes.
Where it's, just 30 minutes a
Hmm.
manual, but then they get their home exercise, and that's the membership tonight is referencing.
Hmm.
And that's something that they get.
And that's exactly what I say is like the tune up. So I'm going to literally flip this 180. So that patient who had come in for manual therapy, this quote unquote tune up might be just a cupping session for that specific shoulder pain because the AGP is solid and I know that he's going to continue to do it. But it might be 1 month out that we need a couple cupping sessions a month. And the next month after that, maybe 2 months out, it's like, okay, I've gotten to the point with my AGP where I feel like I could use some new moves or use some progressions. Then we can use that maintenance membership to beef up that home exercise program to ensure that there's still gains. And I would like to say too, like, even if we don't do the maintenance membership, check-ins are integral. So I just checked in with
Yeah.
a patient that I had over a year ago, and I checked in with him over the weekend to see how his shoulder was doing because I haven't heard from him in a while. And I was checking him regularly, but it's been a little bit now. So I'm like, hey, what are your goals? How are things going? He's like, yeah, I'm still doing my exercises twice a week. And I was like, dang, like this is literally why we do what we do. Because if you discharge from physical therapy and you stop flat in your tracks and you continue to not do anything, you're literally going to go down a horrible, horrible spiral back to where we were with weakness. Yes, you've made gains, but if we don't continue to focus on the maintenance, we're not going to continue to get better and continue to confidently be able to do the activities that we want to do. So that's why cash pay is so much different than insurance based because we want to know like what's next. Like we want to be here to help you after the discharge and know that it's not a revolving door of every week, but it's also an option that you can continue to get better beyond the discharge from PT or if another injury pops up too. I think it's always good to do follow-ups and check-ins because it might be my shoulder is good. I'm still doing my exercise 2 times a week, but I want to run an 8:30 mile and my left ankle's been bothering me. So it's like just those little check-ins truly go a long way. And you don't know unless you listen or reach out what their story is.
Yeah.
So
Yeah.
yeah. Do
Absolutely.
you have any specific questions for me, Kelly?
No, this is just like more and more affirmation of like just asking those questions and finding out what those goals are for those patients. And for me, it's sometimes what are the parents' goals and then like what are the kids' goals? Like
Mm-hmm.
those align. Um,
Yeah.
Sometimes I have to be a bridge for that and be, a little more realistic, or maybe I have to be motivating, or, it looks
Mm-hmm.
different and that's the point, right? We sell the same
Right.
thing, but the story behind it is different,
Mm-hmm.
and we make it fit for that individual. And that's why it's so important to have one-on-one physical therapy, because we have the
100%.
time and resources to do that.
100%. And I think one last thing I want to hammer home is like one thing that I know you and I both practice in general and in the majority of our therapists do is like we want you to continue activity. So if you're watching this and you're someone who's either had an injury and you've been told like rest is best, rest is not best. Like our goal is to keep you training for that triathlon, training for that specific, event. And if it's a major surgery where we have some parameters to tail back, like we're going to listen to those, but then we're going to continue to allow you to get back to activity because we want you to do the things that you love and not feel like you're limited just because rest is best. And that's not the mentality that we want to deliver as a whole with PT. So,
Yeah. Yeah. Well, thank you so much. So we'll
thank
have
you.
another call in 2 weeks, and we're going to be talking about how I've been leveraging AI to help interpret data from different testing, and how you can also use that to give different deliverables to patients and just make very clear, almost like products to be able to
Yeah.
give to the patient so they feel confident in their recovery. So it's going to be fun.
I'm
But
excited.
thank you so much. This was
Thank
great.
you.